Nearly 40 million Americans have diabetes, nearly half of which are people with type 2 diabetes, age 65 or older. Now, this population has a higher risk of developing diabetes related complications, so managing the condition with the latest diabetes tech is crucial. Medicare has expanded its coverage to help, but less than half of those who qualify know about it. Today I have Dr. Kazemi. He is the Chief Medical Officer for Abbott Diabetes Care Business. And Fran List is a Medicare beneficiary who lives with diabetes. Good morning to both of you.
Good morning.
Dr. Kazemi, someone with diabetes needs to know their glucose levels. What kinds of challenges do people have with diabetes face daily when it comes to keeping their levels at a healthy range?
Well, diabetes is a complex health condition, and this really involves how the body converts fuel to energy. This involves the hormone insulin. So in the case of diabetes, what will happen is either the body is not producing enough insulin, or the insulin it is producing is not being used efficiently. The important thing to realize is that often the symptoms of diabetes are mistaken for those of normal aging, things like worsening vision or needing to go to the bathroom frequently. So it's very important, especially as we get older, to get screened for diabetes on a regular basis, and to also know that we have technologies like continuous glucose monitoring, or CGM, that can actually make a big difference in terms of improving the quality of life for people living with diabetes.
Now, speaking about continuous glucose monitors, tell us more about that and how do they work?
So continuous glucose monitors, or CGMs, are been available really for about 20 years, but they're unfortunately being used by less than 10% of people living with diabetes. In the case of the Freestyle Libre sensors, some of these can be worn for up to 15 days, and some of them are as small as 2 stacked pennies, so they're very actually tiny and discreet, and they they continuously measure the glucose values, and they relay this information from the back of the arm where they're applied to an either reader or a smartphone app. And then this glucose information can be used by the person living with diabetes to make more informed decisions about their medication, about their food choices, and about their activity choices. So really an essential part of diabetes management.
Now, Fran, you have experience with diabetes and CGMs. Can you share more?
Well, I will tell you that when I was diagnosed with diabetes, like so many people my age, I was in denial, and occasionally it was overwhelming. Once I started using my CGM, I felt it was life-changing. I really, really enjoy the knowledge that I gain from it. It helps me make good choices about the food I eat, good choices about the activities that I engage in. My husband and I like to travel. We're not afraid to go anywhere because I have my CGM.
Now, there's been a change in Medicare that means more seniors living with diabetes can use a CGM monitor. Is that correct, doctor?
That is correct. So in April of 2023, the Medicare rules were modified to allow for anyone who's on Medicare who's using insulin or who has problematic low glucose values to be able to access continuous glucose monitoring technology. That means about 2 million individuals are eligible, but we know that less than half of them and their healthcare providers are actually aware of this change. And that's part of the reason why Fran and I are here today, is to help spread awareness around this change.
Fran, I have a very interesting question for you. How easy is it for you to use this new technology?
It's like waving a magic wand and and lifting my phone to my face. It is so easy. I couldn't ask for anything better. It certainly beats a finger stick.
No, I hear you. Now, doctor, where can our viewers go for more information?
So for those who are on Medicare, they can certainly contact their Medicare plan to determine if they are eligible. For those who are eligible, these technologies are available for little to no monthly cost. And otherwise, if they just want to learn more, they can visit myfreestyle.com.
Dr. Kazemi, Fran, thank you so much for joining us on Morning Blend.
Thank you for having us.